Welcome to Broad Eye, the podcast that explores knowledge gaps in ophthalmology and eye care. Hello, everyone, and welcome to another episode of the Broad Eye podcast. My name is Sean Maloney, and today I am speaking with Dr. Alan Roth. Dr. Roth is the president of the board at the Cleveland Eye Bank Foundation, as well as a practicing clinical ophthalmologist at the Cleveland Clinic. Dr. Roth, welcome to the show.
Thank you. Thanks for having me.
It's my pleasure. So we're going to dive into a few topics today, but I was hoping we could kick it off just with a conversation about you and maybe the 50,000 foot view of your career journey, if you don't mind.
Sure. Well, I'm born and raised in Cleveland, Ohio, and I did my undergraduate work at Washington University in St. Louis. Graduated from the Case Western Reserve University Medical School here in Cleveland, trained internship and residency in ophthalmology at Mount Sinai Medical Center in Cleveland. Had a basic sciences in ophthalmology course at Stanford. Did a Corneal fellowship at Tulane University under Dr. Delmar Caldwell in New Orleans. And then I was in private practice for 12 years back here in Cleveland. And I've been a staff physician at the Cleveland Clinic Cole Eye Institute for the past 23 years. I'm married, have a beautiful wife, 4 children, 2 daughter-in-laws so far, and just living the dream, as they say.
No, that's great. You have to put the plug in there with the family, right? Because
Right.
we all know that's the important part. So,
Right.
no, thanks for that.
Sure.
Quick question, but why cornea? I always like to ask people, when they get into a certain subspecialty within a specialty, what is it that maybe drew you to cornea, or does that just kind of happenstance?
Well, I actually, when I was doing my ophthalmology residency, was torn between retina and cornea. So I actually looked around during the interview process at both areas for a fellowship, and just this opportunity came up in New Orleans, and so that's sort of where I went.
No, that makes sense. So I was wondering if you can give a little bit of a I'll call it a journey, I guess, or maybe what has changed when it comes to cornea, whether it's diagnostics, research, therapies, etc. Maybe what's changed over your career, and then maybe if there's anything in that space that you find particularly promising or exciting.
Sure. Well, when I did my corneal fellowship training, the big push was to perform full thickness or penetrating keratoplasties. This was in the late 80s. And eye banking was improving at that time. Donor availability was improving. And when I first went into practice, corneal transplants were performed as an outpatient procedure, but people were put on wait lists until the corneas became available, and we were always rushing to perform transplants in the evening and sometimes in the middle of the night when the corneas became available. We get the operating staff in and the patients in, frequently on weekends, because you just couldn't leave a busy practice in the middle of the day or get surgery time when the operating rooms were taken. So that improved over the years to the point where there was enough donor tissue availability and the improvements in the preservation media such that the donor corneas had a viable shelf life of several days. And so therefore we could schedule patients for surgery, and they could be done, on your normal operating time at whatever institution you were working at. The same time you were doing your cataract surgeries, for instance, you could do a cornea transplant in between. So that really improved the logistics of doing cornea transplants. And then over the last few years, improvements in the cornea transplants became available with partial thickness cornea transplants or lamellar corneal transplants, and that really revolutionized the treatment, because with full thickness cornea transplants, there was a lot of stitches, there was wound issues, and so the partial thickness corneal transplants have improved greatly on some of those issues. There's two procedures called DSEC and DMEC, which can be performed through small incisions, just like cataract surgery, and it's a much faster visual rehabilitation for the patients, and much less risky as far as trauma after the surgeries, and so that's the biggest improvement that I see. The increased storage time and preservation of these tissues, and the improvements to the partial thickness, less invasive procedures.
Oh, fair. And you mentioned the relationship here with iBanking, and this is a good segue into the next topic I wanted to bring up. Was your other role, when I think you have a few different roles, professional roles, but one of them being president of the board at the Cleveland Eye Bank Foundation. For people listening to this who have heard about eye bank foundations, but maybe have no familiarity with them and what they do, can you shed some light on that, on what the foundation does, and and who benefits from that work?
Sure. Well, let me sort of back up and give a little history as to sort of how we got to where we are with the iBank Foundation, if I may. In Cleveland, we had the pride of being able to say the first cornea transplant was done in 1945 by a Dr. Charles Thomas, and that was at University Hospitals of Cleveland. At the time, there was only one eye bank in the United States, and that was in New York. By 1958, the Cleveland Eye Bank was essentially founded as the Central Eye Bank for Sight Restoration. So that was actually the first eye bank outside of New York. In 1964, we officially changed the name to the Cleveland Eye Bank. And as I mentioned before, when we started, it was hospitalized patients done on a sort of an emergency basis. But with the advancements in the corneal donor storage, media, and preservation, we transitioned to outpatient surgeries. And by the 1990s, when I was actively involved in transplantation, and I got involved with the eye bank at that time, or actually in the late 80s, there was a push for professional and public awareness, so that hospital employees were being trained on educating families about donation when the time arose. The nurses, were trained, and so that was a big improvement in helping eye banks all across the nation procure suitable donor tissues for transplantation. And then around 2012, the Cleveland Eye Bank actually merged with the Ann Arbor Eye Bank, and eventually got the Illinois Eye Bank, the Connecticut Eye Bank, and the New Jersey Eye Bank all involved, and became an organization called Eversight, which is in existence today. And at that time, when the merger occurred, the endowment funds that the Cleveland Eye Bank had raised over the years from 1958 to 2012 were kept separately, and that was the beginning of the Cleveland Eye Bank Foundation. And so now the foundation's purpose is to have a grant program using these endowment funds to perform research at this point in the Cleveland area. And so we've been working in concert with three major institutions in our area, the Cleveland Clinic Cole Eye Institute, the University Hospitals Eye Institute of Case Western Reserve, and the Akron Children's Hospital. They have a vision center there. And so we now give unrestricted grants to these institutions to perform a variety of research, which we can then get into further on during the podcast.
I'm going to put you on the hot seat, not the hot seat, but I just want to actually just dive right into that right now rather than later. I mean, you were talking about, procuring tissue for transplants, for corneal transplants. But I was just wondering, in terms of the research supported by the foundation, so there's money, and then I'm assuming that there are donor tissues as well. Is the research limited to cornea and corneal disease, or are the research tissues that are procured also used to study other diseases or natural aging, et cetera?
Right. So now the foundation is not in the business anymore of processing donor corneas or limiting the funds to research for corneal disease. There's ongoing studies for diabetic retinopathy, glaucoma, age-related macular degeneration, many other congenital conditions.
Okay, no, that's perfect.
Yeah.
That makes it makes a lot of sense. I'm thinking, you're procuring these tissues and you're not controlling necessarily for the donors, right? It's like whatever, if someone's willing to donate, you're accepting that, and then you're using that as best you can to support the research, right?
So the research that we fund, for example, Dr. Doug Ree at University Hospitals. He's the chairman of the Case Western Reserve University Department of Ophthalmology and Visual Sciences at University Hospitals Eye Institute, and he's doing glaucoma research. And then Dr. Dan Martin at the Cole Eye Institute, who is the chairman of the Cole Eye Institute, and he's a professor at the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University, and he's working on the effects, for instance, of intravitreous antivascular endothelial growth factor versus sham treatment for the prevention of vision-threatening complications of diabetic retinopathy. He happens to also be the chair of the Diabetic Retinopathy Clinical Research Network, the DRCR, which has 6 trials ongoing or about to launch with, I think, 1,800 participating clinicians. We haven't directly funded that yet, but that's being funded by a host of sources. One of our board members, Dr. Jonathan Lass, is the former chairman of Case Western Reserve University, has been doing research on acute corneal edema decades after penetrating keratoplasty for keratoconus in eyes wearing scleral contact lenses. There's another researcher at the Cleveland Clinic, Dr. Brian Perkins, who's performing research using our funds on primary cilia that are present on endothelial cells of the hyaloid vasculature, but are not required for the development of the blood-retinal barrier. Dr. Paul Park at Case Western Reserve and University Hospitals is doing research on differential adaptations in rod outer segment disc membranes in different models of congenital stationary night blindness. Dr. Hurdle is doing research at the Vision Center in Akron, the Children's Vision Center, where he's working on a host of conditions because there are 350 hereditary eye diseases such as albinism, aniridia, color blindness, corneal dystrophies, glaucoma, keratoconus, Leber's congenital amaurosis, night blindness, retinitis pigmentosa, and retinoblastoma. It's actually estimated that 30% of total blindness is from genetic or inheritable diseases of the visual system, with congenital defects accounting for another 11%. So his research is going to be tremendous for young children and young adults with all of these congenital conditions. Dr. Irina Pikuleva from Case Western Reserve is doing research on retinal cholesterol, and there's others. Dr. Connie Tam is researching whether antibacterial eye drops can help prevent or reduce the severity of the disease caused by Pseudomonas, which is a major bacterial pathogen which leads to serious eye infections. So these are the studies that so far the Cleveland Eye Bank Foundation, the funds have helped support. So there's really way more than just corneal work being done using these funds.
I don't think you could have answered that question any better.
Thank you.
And like, okay, here's a dozen examples of we're not just cornea. No. That's amazing. Now, is this something that you think is fairly unique about the Cleveland Eye Bank Foundation and the breadth of research that it supports, or if there's any other unique aspects of the foundation that you're interested in pointing out?
Well, what I see as unique is that it's a new foundation. Essentially, there's much larger foundations in this country, but this is a local foundation that at this point in time has been trying to provide the funds for our local institutions in Northeast Ohio. Which I think is very unique. I don't know that there's another eye bank foundation or eye research foundation quite like it in the United States.
And you highlight the local focus, but for people who are not familiar with the Cleveland Clinic and the ophthalmology program there and the research that goes on there, you're not just talking about some sort of, small town research program and, small impact. I mean, some of the most impactful research studies and come out of the area, right? Come out of the Cleveland Clinic and the researchers there. So as much as there's a local focus on the funding from the foundation, you're supporting, an array of, world-class clinicians and scientists, right? It's not just somebody down the street, right?
That's right. I mean, the ongoing research is already being funded by other organizations as well, of course, and this adds the local support that's needed at the Cole Eye Institute. The new chair of the Ophthalmology Research Department, Bella Anand Apte, is instrumental in organizing all of her researchers and the labs at the Cole Eye Institute. I know a lot of places labs are separated from the clinical areas, but I know at the Cole Eye Institute the labs are right in the building, so that's really it really helps combine the clinical resources and patients that are willing to contribute to eye research, essentially from bench to bedside, as they say.
Oh, no, for sure. And for anybody who is a researcher training in that environment, it's night and day, right? When, and I've been in both situations during my own studies where you're more isolated and you're in a lab and you have this theoretical, hypothetical patient impact down the road, and you can kind of see that. But when you actually like speak with patients with these diseases, or you're seeing the imaging being done these patients, and it's like, whoa, this is
Right.
real. No one's playing here, right? And it
Exactly.
gives you a different, and it just gives you a different perspective. And I think that centers that bring the clinical and research elements very close together, and vice versa for the clinicians. The clinicians are the frontline workers who can, even inform the research before anything's ever published and say, hey, I'm seeing this and this and this, or it'd be amazing to have this type of test, or if there was a way to know this. And just those back and forth communications can lead to some of the most amazing research, which certainly, the Cole Eye Institute is among the leaders in that space, right?
Right. So if I may, I'd like to, at this point, just kind of give a plug. The research that I mentioned was presented last year in our first virtual vision research symposium, and our upcoming second year symposium is going to be on Tuesday, February 15th, 2022, from 3 to 5 p.m., where many of these researchers that I've just mentioned are going to be presenting their latest research breakthroughs and updates on some of the research that they presented last year. And this is a free event and open to the public. And to register for the webinar, if I may, you can go to the Cleveland Eye Bank Foundation's website, which is cleyebankfoundation.org. So I'll repeat that. That's cleyebankfoundation.org. So it's all one word, .org. Or you can actually find it on the foundation's Facebook page and access the registration link there. And I think if you're interested in these kinds of things, that would be a very good use of 2 hours of your time, and very interesting and very fascinating.
Oh, no, for sure. You're stealing my thunder. I was going to serve this up as like a great topic and ask you. No, this is all. No, this is great. But just maybe on a just kind of a last point I can come to around that is we talk about researchers and clinicians being in the same space and having conversations. This type of symposium can really try to put researchers in contact with the public, and for the public to understand when they are supporting research, like actually where is this money going, what's happening, what's going on in the field. And I think that's bridging that gap is certainly valuable. Do you see I don't know how I want to frame this question, but that connection, I guess, between the public and researchers? For looking at last year's symposium, have you seen a lot of enthusiasm around that from the research, or from the research community and the public? And has that been helpful, I guess, in fostering support for the foundation from the public?
Well, yes, we're trying to get the message out there. The symposium last year had some reporters present from different medical journals, and I might just mention that Ophthalmology Times attended and then published a summary of all these presentations that were given at the Virtual Vision Research Symposium. So that got it out there to those of us that do, read those types of medical journals, and then we've also, with social media, tried to get our mission out there through, our Facebook page and Twitter, et cetera. So our social media has been improving and growing, in the last year or two. And I think that fosters, a lot of interest for the general public.
Excellent. No. So I guess my last question for you is, for people who are listening to this, they want to partake in the symposium, the virtual symposium, and you highlighted how they can do that. But people who want to take a next step and support the iBank Foundation in some way, what opportunities exist out there other than attending the virtual symposium to support the iBank Foundation?
Well, if you go on our website, you can learn more, and there's links there where people can actually donate funds to the cause. So that's probably the best way at this point to get involved and get on our mailing list, as they say.
Excellent. Well, listen, for anybody listening to this, I hope they follow that advice. They check out the Virtual Research Symposium. Again, that's February 15th. I think you said from 3 to 5 p.m. Eastern time.
Correct.
So we can certainly link to that in as we publish this episode of the podcast. And I hope that they continue on and support the foundation in any way possible. So, Dr. Roth, I certainly appreciate you taking the time to chat with me today. Definitely been fun. You're obviously somebody who is doing a lot of great things in the space, as a researcher, clinician, and with the foundation. So I'm sure you're only at the beginning of your long career in this space, despite you mentioning the 12 years and the 23 years and all those things, right? So right. You mentioned the wonderful family that keeps us all young. So that's right. I'm happy to speak with you and really happy that you're doing this great work.
Thank you. And we appreciate the opportunity that you've provided for us to get this out further to the public. Thank you.
Excellent. Thank you. And that concludes today's episode of the Broad Eye Podcast. If you enjoyed this episode, please be sure to subscribe on your favorite podcast platform. Of course, ratings and reviews are always welcome. And you can certainly share this episode with any of your colleagues or friends who might enjoy it. Thanks for listening.